There are postpartum moms right now who are walking around with swelling in their legs, they're short of breath, they're having chest pain, and they're being told it's anxiety. You just had a baby. Just go home, get some rest, drink some water. What if it's more than that? What if their heart is failing? Today, I want to talk about an important topic that is often missed, something that I see time and time again in the emergency department, and that is the topic of postpartum cardiomyopathy. Welcome to Fourth Trimester Voices, the podcast where we delve deep into the fourth trimester. I'm your host, Dr. Choa. Welcome back to Fourth Trimester Voices. My name is Dr. Choa. I'm a postpartum physician and an ER physician in Atlanta, Georgia. So today we're going to talk about postpartum cardiomyopathy. I recently had a patient, she was in her mid-40s, who came into the emergency department. Now, she was so excited that she had conceived a child, which I'm sure had taken so much time to do between her IVF appointments, between everything that she had to go through to get to this place. And so being in the emergency department was not something that she was really happy about. Now, talking to her, she was extremely short of breath. She could barely keep her words. She required us to put her on oxygen. And just having the conversation about what was going on and how long things had been going on for, she basically told me that probably for about 1 week, she had been increasingly short of breath. In the hospital, she had an amazing labor experience, except for she was diagnosed with preeclampsia after her baby was born and started on magnesium. But then she was discharged home, may have been okay, but about 1 week later, they put her on some blood pressure medication. And she basically, at that time, was not really worried that anything else would happen. She had just overcome this hospitalization where she had something that people worry about all the time, preeclampsia. She was doing well. She was bonding with her child. She was in bliss. So 3 weeks went by and she was not checking her blood pressures at home. And so when she presented to the emergency department, it had been 3 weeks after she had a baby and she was short of breath. She could barely speak in full sentences. And doing this over and over again, I knew the diagnosis just by looking at her. I listened to her. She had fluid in her lungs. Her blood pressures were elevated in the 180s. And I just looked her in the eye and I was like, you're going to be okay. But I'm really concerned about your heart. And that thing I was concerned about is something we call postpartum cardiomyopathy. And that is when, after you have a baby, the heart does not pump as well. The function of it decreases because of the pregnancy itself and the physiology that is happening, which we're going to talk about right now. So let's talk about what cardiomyopathy is. So this is a condition where the heart becomes enlarged and weak and just cannot pump as well as it should. Now, you know the heart is required to pump well in the body because it pumps blood that is rich with oxygen to our brain, to our organs, to different parts of our body to help us function, to help us move, to help the body work. And so when the pump is not pumping well, a lot of things are deprived of oxygen and our body just does not function as well as it should. Typically, postpartum cardiomyopathy happens after a woman gives birth. And usually it happens within the first few months. So it's not always just those first 6 weeks. It could be 3 months, 4 months down the line. Here's the issue with postpartum cardiomyopathy. A lot of the symptoms overlap with what we call normal postpartum. So there's the fatigue, they're just feeling really overwhelmed, the swelling, the shortness of breath, where people may feel like I'm just deconditioned, like I've just been sitting around, my body just carried this big old baby, and I just feel winded. And so often this diagnosis gets missed, and it is too late by the time they present to the emergency department. What is actually happening during your pregnancy is that your heart is already putting in work. So, in your pregnancy, your heart basically is working harder because you have more blood volume, right? You have a whole baby for 9 months. And so your body is producing more volume of blood to be able to do the things that it needs to do and get oxygen blood to different parts of your body and your baby. And then your heart, as a result, is pumping harder and your body is under significant stress. For most women, not a big deal. You adapt easily, right? You can handle this. But for other women, unfortunately, the heart becomes overwhelmed and something goes wrong. So there really isn't a single cause for postpartum cardiomyopathy, but the leading theory is that the body is under stress, something we call oxidative stress. So basically, after you deliver the baby, the body goes through major hormonal shifts. That stress can cause a hormone called prolactin to break down into toxic, something so toxic that it affects the heart. And so it damages the muscle cells of the heart, it affects the blood vessels, and it reduces the heart's capability to pump. So, what does that mean? It means that the heart becomes weak, the heart becomes enlarged, and the heart becomes less efficient. And instead of pumping blood forward like it should, the blood starts to back up into the lungs, into the legs. And that's when a mom becomes short of breath. She can't lie flat. She starts getting swelling in her legs. And really, she's really tired. And the reason she's tired is because there isn't forward flow of blood because the heart can barely pump. And so the blood just backs up instead of going forward to give oxygen to different parts of the body. The stress of pregnancy does not just stop once you give birth. This is what a lot of moms think, and this is really the myth that is out there, that suddenly when you deliver a baby, the risk goes away, the stress goes away, but the body is still recovering from the stress of pregnancy. In fact, postpartum is when your body is going through dramatic shifts because it happens suddenly. So the blood volume is decreasing, hormones are rapidly changing, and your blood pressure can spike as a result. And if the heart was already struggling because of risk factors or hormones, that can apply much more stress and can tip it over to failing. Here's what I want you to hear me say as I'm talking to you on this episode. These symptoms are not going to be normal. Shortness of breath, chest pain, overly fatigue, feeling like you cannot breathe when you lie flat. I had one mom describe that feeling as anxiety. She just kept saying, every time I lay flat, I feel anxious. I think I'm having anxiety. And anytime a mom says that, I'm concerned because oftentimes when you can't breathe, you describe that as anxiety. And it's something to pay attention to. If your heart rate is spiking up, you're feeling significant swelling in your legs, or just not feeling yourself, I really want you to talk to your OBGYN or your midwife. Let's talk about risk factors. So the story that I told you about the mom who came into the emergency department, she was an older mom. She was in her mid 40s. This matters because when you are over the age of 30, you are at risk for postpartum cardiomyopathy, right? You have a lifetime of stress on your body. And as you get older, your heart just may not bounce back as well as the 18 or 20-year-old who's giving birth. So age is a risk factor for postpartum cardiomyopathy. Race is a factor. Unfortunately, African American women are at increased risk of getting this condition. Carrying multiples. So if you're having two kids, twins or triplets, and as you can imagine, that's because your heart is working extra hard to provide blood flow for three children. So that puts you at risk. And then having a history of blood pressure. So this is the part where screening before you get pregnant matters. A lot of moms are not even going to the doctors until they get pregnant. And so they enter pregnancy with pre-existing conditions such as high blood pressure that they didn't discover until that they were pregnant. So getting a checkup, making sure that you're staying with your physicals is really important. If you've had a history of high blood pressure outside of pregnancy or in pregnancy, or a history of preeclampsia, that can put you at risk for heart failure in your next pregnancy. The strongest link that we see for postpartum cardiomyopathy is preeclampsia. Preeclampsia during pregnancy, postpartum preeclampsia, this puts you at risk for cardiomyopathy. So, mom, if you were diagnosed with preeclampsia in pregnancy, do not stop at your 6-week visit. I want you to be diligent about taking your blood pressures every day after you give birth. I want you to follow up in 6 months. I want you to see a cardiologist because the reality is the effects of that preeclampsia during pregnancy will linger. I talk about this in my course, in my 4th trimester blueprint course, and I really want to emphasize to moms that if you have gone through complications in your pregnancy, such as preeclampsia, hypertension in your pregnancy, you need more follow up than just one 6-week visit because you are at risk for heart disease. And this is something that can be picked up. This is something that can be treated early before it becomes a disaster. Preeclampsia is just not a disease. It's a warning sign towards your future health. If it's not cardiomyopathy, many preeclamptic women will end up having heart disease later on in life. So I really want you to take this seriously if that is a diagnosis that you carry, because it tells you something about your body, it tells you something about your blood vessels, and it tells you something about your heart. We discharge moms to come back at 6 weeks, and that unfortunately is not good. We need to be following you throughout your postpartum period because we know these risks exist. So we know who is at risk. How can we prevent it? How do we prevent this? Well, you can't prevent genetics. You can't necessarily prevent postpartum cardiomyopathy, but screening early can lead to faster recovery. So if you catch it when the heart is just under a little stress, we can give you medications to be able to prevent that heart from expanding, and getting worse and becoming more permanent. For a lot of women, this resolves after treatment, but some go on to have this condition, and the complications can lead to really serious things where moms' hearts just don't function and they require machines and lifelong medications. So if we can screen early and detect early, chances are you can be treated for this condition. What we're going to have to do, we're going to have to take every symptom seriously. It doesn't matter if it sounds dumb. It doesn't matter if you're not even sure about asking your doctor about, talk about it. Do not normalize severe fatigue. Do not normalize shortness of breath. I want you to check your blood pressures every day postpartum. Whether you had preeclampsia or not, whether you had a normal pregnancy or not, mom, you're going to pick up a blood pressure cuff, and I want you to check your blood pressure every single day. I want you to follow up sooner than 6 weeks, if something feels off. And I want you to advocate for yourself. Know your symptoms, advocate for yourself. And for my doctors who are listening, or my midwives who are listening, we need to stop dismissing symptoms. If a mom comes in and you're thinking this is anxiety, work her up first before labeling her as anxiety. Because oftentimes moms just don't have the words to say, just because a woman recently gave birth, it does not mean that her symptoms are normal. So I realize that I'm encouraging you here to advocate for yourself. I'm trying to empower you, but there really is a problem with our system and how we treat moms. You have heard me talk over and over and over again about this postpartum gap. We built a system that prepares moms for birth, for pregnancy, but then abandons them in recovery. Then we act surprised when moms come into the emergency department in full-blown heart failure. We act surprised, but we're going to miss life-threatening conditions. And this is a systems problem, unfortunately. So that is going to take some time to tear down, and that is the work that I am doing. But in the meantime, Mom, I want you to be aware of your system. I want you to be aware of your risk factors. If you were admitted for preeclampsia, if you were in the hospital for high blood pressure, you're going to need to still check your blood pressure. Just because you got the magnesium doesn't mean that you are out the window. There are very real medical problems that can come as a result. Okay? If you're listening to this, if your body feels off, say something. Do not ignore it. You deserve to be heard. You deserve to be seen. You deserve to be evaluated. You deserve more than one 6-week visit. This is how you advocate for yourself. Listen, Mom, I want you to go to my website, Dr. Choa, courses.drchoa.com. And I have a course there called My Fourth Trimester Blueprint. It's $27, and it gives you everything that you need to know, that you need to ask when you've had preeclampsia. And it tells you how you should be recovering. It tells you what labs you should be getting your doctor to order. It is a great course to help you prepare for entering your postpartum period, so you know exactly what to expect. We need more moms going home and staying alive. And these are the things that we have to do. We are going to have to prepare ourselves. So if you have any more questions, please follow me on Instagram at Dr. Choa. I would love to hear from you. Like this video, share it with somebody who needs to hear it. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.